Good afternoon, everybody, and welcome to our third webinar, the CPHVA webinars that are exploring the NMC draft standards for specialist community public health nursing. My name is Amanda Holland, and I am the CPHVA chair for Wales. I'm also the programme manager of the specialist community public health nursing programme at Cardiff University in South Wales. I'd like to introduce my colleagues as well. Janet, would you like to introduce yourself?
Hi, yes, good afternoon. My name is Janet Taylor. I am a public health nurse manager in Northern Ireland. I'm the current CPHVA Executive Committee Chair, and I also sit on the Occupational Professional Committee for Industrial Issues. Thank you.
Thanks, Janet. Sue.
Thanks, Amanda. Hi, I'm Sue Lowe, and I'm a regional officer for Unite, and I have national responsibility for the organising professional committee of our health visitors across our nations. I enjoy supporting our SCPHNs, especially via a lot of the joint working we do with CPHVA. So I'm here to help and enable some networking today.
Thanks, Sue. And Dave, who's in the background.
Hi everyone, I'm Dave Munday. I'm Lead Professional Officer with Unite the Union in the health sector. I lead on mental health, but today I am producer of this CPHVA Live. So please all cross your fingers that this is going to go amazingly well.
Thank you to Dave for producing this session for us today. We couldn't have done it without him. Thank you so much. Also, thanks to Jane Beach, who unfortunately is not able to join us today, but has worked very hard in enabling us to deliver these 3 webinars over the last month or so. Jane's also prepared a presentation that I'm going to share with you in a few moments. Just before I do that, I just need to let you know that we are recording the session. I know that Dave has sent out information about the recording. In the meantime, could we ask you to mute your mics and keep your videos off just for now, but later on when we go into our breakout rooms, we will ask you to unmute and put your video on so that you can engage in some of those discussions as well. So the way the next hour is going to work, I've got a couple of slides to go through with you, reintroduce some sort of those key themes and things within the draft standards, and then what we're going to do is look at some specific themes that we've explored in a little bit more detail, and then look to see how they relate specifically to health visiting and school nursing. And then when we go into our breakout rooms, that will be a time then for you to discuss those themes in a little bit more detail, so that you can speak openly within those rooms about your views around that. And Jane and Janet and Sue and myself will be in those rooms with you. We won't be able to record in those rooms, but we only will be recording when we come back to this main session, and the recording will be available later on. At the end, please engage in our poll, because we'd like to understand how we've helped you to sort of think about how you'd like to engage with the consultation. So we've got some polls at the end, which Dave will launch as well when the time comes. So I'm just going to share my screen now and get the presentation up for us to have a look at. Okay. Okay, can you see the screen? All right, lovely. So as I said, this is the third of our webinars. Today we're going to explore some themes in a little bit more detail, but what I wanted to do is just remind you about some of those key dates. So the consultation was launched on the 8th of April, and we know it closes on the 2nd of August, so that's not long now. So I'm hoping that you will have time to engage in that, to share your views. The aims of the standards, the aims are for this to be published by 2022 and adopted by all AEIs by 2023. And currently, we want those current standards to be withdrawn by September 23. So of course the NMC have had lots of webinars, they've had drop-in sessions and things like that to engage us all. There's been lots of opportunities. I've been working with the NMC on the working group in relation to developing the draft standards for health visiting. So I've been working on that, and I know if you go onto the website now, you can still sign up to engage in some of those drop-in sessions, which I would encourage you to do if you do have time. And then in terms of responding, you can respond to the consultation as an individual. I did myself a few days ago, and we're also going to give a response as the Community Practitioner and Health Visitor Association. So as a professional group, we're going to provide a response to the NMC. So today it's all about you. It's all about you having your voices heard, having that opportunity to consider and discuss with colleagues. So we will summarise some key themes for discussion, and then we'll look at those within breakout rooms where we'll have 10 minutes to discuss those themes. Then we'll come back into the main room, and then we'll just sort of see what those discussions were, and have a bigger discussion then. Then obviously just really a time to encourage you to share your views and your opinions within those rooms with your colleagues. We'll all be allocated randomly, and Dave will be able to do that for us when the time is right. So just to remind you about the proficiency, obviously they consist of core standards that apply to all fields of scuff and practice, health visiting, occupational health nurses and school nurses, and they're grouped into 6 headings and their core field of influence. And then of course, there are some field-specific standards of proficiency that apply to each of the following fields of scuff and practice: health visiting, occupational health nursing and school nursing. And those are grouped under 4 of the 6 themes. So the 6 spheres of influence run from A to F, and I'm sure you're beginning to become a little bit more familiar with what these involve. So the first sphere, A, is around autonomous specialist community public health nursing practice, and then B is around transforming specialist community public health nursing practice, evidence, research, evaluation and translation. C is about promoting human rights and tackling inequalities, assessment, surveillance and intervention. D is around population health, enabling, supporting and improving health outcomes for people across the life course. E is advancing public health services and promoting healthy places, environments and cultures. And finally, F is leading and collaborating from investment to action and dissemination. And it's C through to F that then is more sort of field specific for health visiting, occupational health nursing and school nursing. So the first thing that we've picked out is in relation to public health practice. So the core from these draft standards is embedded throughout all of the spheres. So from right through from A to F. So in relation to A, which is autonomous practice, we're seeing that that's containing information around what's expected around autonomy, innovation, socioeconomic and political agendas, around influence in health literacy, cultural competence, unconscious bias, and how we lead and influence change. And then B, which is around transforming scuff and practice, well, that's around generating, critiquing, applying data and information, evaluating public health interventions around improving health and well-being. Then where we're looking at the sphere of C, which is promoting human rights, that then is about exploring those health inequalities, understanding how SCPHNs are able to work with communities and with individuals and families to understand the wider determinants of health, breaking down those barriers through compassionate leadership and health promotion strategies and innovations. Then D is around population health, so genomics, human development, assessment of health needs, preventative interventions, community assessments, life course approaches, partnership working, and leading on policy and evaluation. E, which is around advancing public health services and promoting healthy places, environments and cultures. Within this particular core, it's broken down into technologies, cultures of learning, health promotion, sustainable environments, planning, emergency planning and pandemics. And then finally F, which is around leading and collaborating. So that is then focusing on public health leadership, partnership and communication. So we're now going to have a look at the core in relation to health visiting practice. Think about how that core then is broken down into the field of health visiting practice. So in relation to health visiting, this then is broken down into these aspects. So we're critically analysing, applying evidence-based knowledge of the broader determinants of health, intergenerational cycles of deprivation in health, inequalities that affect the physical, mental, social, emotional, and spiritual health and well-being of children, parents, carers and families. Working in partnership with children and families to identify risks to healthy weight in childhood, including childhood obesity, malnutrition and body image, promoting family nutrition and supporting them to make positive lifestyle choices and referring to other agencies according to need and risk. It's about working in partnership with families to promote the benefits of children learning life skills in the home environment. So that's how the public health core is then explored in relation to the field specific for health visiting. Then for school nursing, we can see here that is then focusing on use of specialist evidence-based knowledge to identify vulnerability and inequality within the school community, identifying those needing support and those at risk. Synthesizing data, information and intelligence about health priorities for home, school and community environments, and using professional judgment to determine how this can be used to positively impact individuals and community health and well-being for the school age population. It's advocating for children and young people in public health services, ensuring their voices heard and supporting the co-production, co-design and development at universal, targeted and specialist services. So I went through those quite quickly because we are sort of stuck for time, and I think that we are going to benefit from breaking into our groups now. So I'm going to stop sharing my screen, and I've asked Dave to put into the chat box those field specific points in relation to health visiting and in relation to school nursing. So Dave is going to randomly allocate us into groups now, and if you access the chat box, you'll be able to see those specific points which would be a starter to guide a discussion. So we're going to break out into our breakout rooms now, and for the next 10 minutes have a discussion within our groups. So Dave, are you able to allocate us all into our groups? We're all back in the main room now, I believe. We've all been drawn back in. We had that 1 minute warning, and it was just kind of waiting then to see when it was going to happen, if we were going to be mid-flow or not. So so I hope everyone made it safely back. Thank you, Dave, for bringing us back into the main room. Well, that was an interesting discussion. We've got, over the next sort of few minutes, just very sort of briefly here, if I just highlight what came up in our room around that, the general feeling was that these are very broad, and you know, some of the feeling was that it would be helpful if they were a little bit more specific. There was concern around interpretation, different interpretations of these broad standards across the UK, I guess. So there was some concerns around that, and the parity of programmes in different places because of the broadness of that. And it also came up that in Wales, we have a new role, which is a clinical practice educator. who is there to support the practice assessors and practice supervisors, and perhaps would help them to understand the standards in relation to the programmes within Wales and in relation to meeting the needs of the communities. But then this role, you know, is something different in other areas. So I think Kat talked about there being a learning facilitator role and things. So that was interesting. So Janet, what kind of themes did you have come up in your room? Oh, you're on mute, Janet, at the moment.
Rookie mistake. Right.
Yeah.
The general feeling is that this actually articulated and it did sum up very well the role of the health visitor and the specialist practitioner. Yes, there were concerns around how this would be delivered. And I think that would marry in with what you're saying with different approaches across the 4 countries, depending on the capacity and the workforce that was available. So, you know, the concern would be, how will this be delivered? The V100 and the V300, the V300 to be included in a programme of this length, which is a significant piece of work to undertake. It was felt it was a big ask again, back to capacity. And the reality is, one of the members pointed out that the V100, whilst it's pretty much compulsory, no one really uses it. You wouldn't be interviewed for a job if you didn't have your V100. However, the reality is, health visitors aren't using it. It's too complex, too difficult, too time consuming. You know, it just doesn't work, and it's basic prescribing anyway. So there was kind of conversation around the validity of including the V100 and the V300 within these spheres. And just really, it's a big ask in the length of the programme and back to capacity of the assessors and supervisors on the ground with very weighty caseloads.
Yeah. Oh, some good points there. And of course, you can comment about the V100, V300 in the consultation, and that people must do that.
Absolutely. Yeah.
Sue, how is your room? The discussion?
Yeah, so we had a majority health visitors in there, but we did cross over to school nursing as well. So we talked about the fact that the focus on specific outcomes such as obesity is disproportionate often, that because that's part of a bigger public health picture, that seems to get missed, and that we'd like to emphasize that actually it's about public health approaches. It's not about single outcome approaches, which, as you're aware, a lot of trusts have gone down that route. That actually the standards are too generalized. They don't give those specifics. So again, they are open to interpretation. That actually the importance of population-based health and a community focus is not necessarily emphasised there. So things like the work that can be done around parent-infant interaction, which then leads on to safeguarding, just isn't going to happen and isn't happening in some areas. Obviously, we talked about the loss of clinics and public health work around public health engagement, health promotion, those scenarios that have disappeared, and that led us into the school nursing, losing that contact as well. And again, one of our colleagues was saying that they literally, somebody else does all the other work while they pick up the safeguarding. It feels very much that we've lost that quality. So the need for public health activities, we feel, is as strong as it's ever been, but actually less targeting, more universal, because the universal work, we were literally mid-sentence on this one, leads to targeting, leads to identifying, but if you don't do the universal, you don't pick up everybody through a targeted approach.
Yeah. Right, really interesting. And of course, we could have so much longer on this, but we do have constraints with time. So let's move on to the next theme. I'm going to share my screen again. So we're going to have a quick look now at the next slide, and this was exploring how safeguarding is included within the draft standard. So from a core perspective, it's leading on identifying vulnerable people, families, communities and populations, and taking action to support, safeguard and protect them, and coordinate timely emergency care and support when needed. Leading discussions and making decisions in conjunction with other professionals regarding the referral, support and management of children and families where there are concerns around the well-being of the child based on an assessment of complex situations and on knowledge of the child and family. So field specific then in relation to health visiting. So identified here is work with parents and carers to promote child safety, reduce risk behaviour and enhance awareness of the differentials of risk in relation to the child's age and the stage of development. Continually assess and skillfully adapt to different environments and complex situations in order to identify and advocate for those families most at risk, while at all times safeguarding the welfare of the child and others at risk. Initiate appropriate evidence-based interventions to promote healthy relationships and minimise risk of domestic violence, child maltreatment and other forms of abuse within the family through using evidence-based knowledge of healthy relationships, the epidemiology of domestic violence and abuse, and the developmental impact of parental conflict on children. Use professional judgment to observe, recognise and respond to signs of abuse and neglect in infants, children, young people and adults. Work in partnership with families to assess, reassess and appraise the impact of changing circumstances and relationships on child and family health and well-being, and adapt to support accordingly, acknowledging the family's whole and prioritising support on the basis of risk and need. So that's health visiting specific. For school nursing, connect with, safeguard and prioritise support for children and young people most at risk, escalating concerns and providing specialist expertise for safeguarding and child protection pathways within and external to the school environment. Evaluate how professional judgment and evidence-based interventions help children and young people consider the impacts of and risks associated with specific behavioural choices related to social media, alcohol, substances, violence, exploitation, gangs, and potential involvement with youth justice. Use specialist expertise and public health knowledge, skills and evidence when influencing and advocating for the safety and well-being of children and young people at multidisciplinary collaborations, meetings and hearings. So I'm going to stop sharing my screen. And Dave, if you could please allocate us into our rooms again, where we'll discuss what we think about how safeguarding is being incorporated into these draft standards. So again, really interesting discussions. And I think once we sort of get going on certain points, there's just not enough time, is there? Just not enough time. I mean, Janet, what kind of themes came up for you in your room then?
Okay, well, once again, really interesting. We were cut off mid-sentence, but I think generally it was quite good for the health visiting aspect of safeguarding, in that it started off with promotion of well-being and then moved on, and of course the importance of risk assessment. But I think it was a general feeling that with regard to school nursing, we almost went straight into safeguarding, and perhaps the reality of school nursing will be that they're not visiting or doing those generic visits as a health visitor will do, that they become involved, of course, when there is an issue. So therefore it's different. However, it did come up, and there's quite different ways of working. For example, in one area, they have school nurses who are assigned to specific aspects of care. I think emotional well-being was one of them. Safeguarding was another, and each took on a different role. But it's the capacity is a massive thing. Capacity again within the workforce to be able to do this. and the support that is needed to get a student through this process. Yes, the school nursing one appeared to be more problem focused, and then also there didn't seem to be too many nods towards the early intervention. Flying Start, there was a member on from Flying Start, I think that's in Wales, but the early intervention aspect to avoid getting to that point of safeguarding, that there wasn't enough emphasis on early intervention and prevention. So I hope that covered it all, ladies.
Yeah. Okay. Thanks, Janet. And Sue, anything to add from your room?
I think it was very much that from a school nurse colleague, that the one-to-one work seems to have become the emphasis in school nursing, and that reflects that. And it's almost that the wider work is like having two jobs, whereas actually it should fit closely together. That actually 0 to 19 and working together with full knowledge of the family is really important. So we did come back to a focus on universal and resources. That you can't avoid that, but the SCPHN role is to do the build up, to be inclusive, to do the whole thing. So from that point of view, we talked about assessment skills, practitioner standards, whether or not are we managing other people to do this, or are we doing this, and that needs to be absolutely clear. Clarity of the SCPHN role that delivers and leads, and that was something that I think we came to at the end of that discussion. That we should be performing all aspects, and that they should have full knowledge of the family.
Yeah, it really interesting. I mean, just to add to that, there was interesting point raised around the fact that we know that these are meant to be future-proofed standards and things, but already one of the school nurses felt that she could already see that by the time these were published, some sort of things could be out of date, because risks relating to young people move very rapidly. So I thought that was a really interesting point. And of course, the use of language, the word gangs, was that appropriate? Was, that sort of thing came up as well. So I think if that can be fed back via the consultation, that would be really helpful. The other thing that was felt as well, that maternal mental health was missing, perhaps not that it's always a safeguarding issue, but it doesn't seem to appear enough throughout all of the standards. That seemed to be missing as well. Interesting as well, in different ways of working, that in one area the health visitors there are covering up to the age of 8 because of the lack of school nursing, and then health visitors are converting, doing school nursing as well. And again, skill mix was coming up, so band 5s doing a lot of the roles that the health visitors used to do, and to then release them to, and then they're concentrating more on safeguarding and things. So there was a point raised that it was good to see more specific. It was a bit more specific here in relation to some points. So so that was interesting. Okay. Right, let's move on to our next theme. Just going to share my screen again. Okay. All right, so I know that we've got 9 minutes to go. I'm not sure if we're going to get through all of this, but let's see how we get on. So just very briefly in relation to the core. So this is about relationships now, and how this has been considered throughout those draft standards. So assessing the impact and complexity, the comorbidity and the impact of people in communities and populations, ensuring equitable and accessible services, improving health literacy, communication, networking, consulting with, listening to and supporting people, communities and populations when assessing and planning public health interventions, using culturally appropriate evidence-based approaches to assess, support, monitor, appropriately refer to specialist services, and empower people, communities, populations to connect effectively with local initiatives, support networks, community assets, programs, and so on. expertly apply knowledge of behavioural, psychological and social sciences to the health of populations, communities and specialist public health practice that enhances collaborative, strength-based therapeutic relationships, use culturally appropriate evidence-based approaches to assess, support, monitor and appropriately refer to specialist services, and critically apply knowledge of populations, places, communities and social determinants of health to inform key areas of specialist public health nursing. So, field specific for health visiting in relation to this. So, health visitors play a significant role in promoting mental health for parents, families, infants and children during the perinatal period, and in the assessment and early identification of perinatal mental ill health, providing care and support where appropriate and facilitating access to specialist services across the level of need. Promote infant mental health and early identification of infant distress, and provide support to families to enable them to respond to their baby's needs. Initiate appropriate evidence-based interventions to promote healthy relationships and minimise risks of domestic violence, child maltreatment and other forms of abuse within the family through using evidence-based knowledge of healthy relationships, the epidemiology of domestic violence and abuse, and the developmental impact of parental conflict on children. Use their professional judgment to observe, recognise and respond to signs of abuse and neglect in infants, children, young people and adults. For health visiting specific, evaluate the impact of intergenerational cycles of dependency and adversity on children and young people, and the opportunities and proactive factors present by early help, present by early help and interventions. Use specialist evidence-based knowledge of safeguarding, mental capacity, consent, confidentiality for the child and young people to critically analyse, reflect and manage challenges and potential conflicts related to consent and confidentiality. Foster positive relationships and facilitate inclusive in the school community, applying specialist knowledge about the potential impact of unconscious bias and assumptions that people make about children and young people, including those with long-term and complex conditions, disabilities and neurodiversity. Demonstrate knowledge and understanding of identity and how to support children and young people to develop their identity, considering factors that influence identity, including sex, gender, sexuality, ethnicity, culture, socio-economic status, and intersectionality. Okay, so let's go into our groups and discuss this last theme. So good discussion there. If we just round up on some of those points quite briefly, as we've just missed our 5 o'clock finish. If everyone's okay, just to bear with for another 5 minutes. Sue, would you like to? Is Sue back in the room with us?
Yeah, I'm here, Amanda.
Lovely.
Right, so we were quite clear that actually these standards were quite adequate. They were very specific. One colleague stated at first it looked too much, and then she realized that actually that they do all that, and there is an awful lot that they do in there, that it reflects well, and they welcomed this section. We talked about the moving picture, that new biases will come along, new cultural needs will come along. We talked about advocacy role. We also once again bemoaned the loss of relationship with communities, and we linked that with the principles of health visiting, the effect on public policy. So where it says empower people, communities and populations, actually do we need to emphasize the fact that challenging those local councillors, those local leaders, those people that influence those policies is actually still very much part of our role. And then we finished very quickly on the effect that isolation has had on people. Are they going to be craving more contact going forwards? Are we going to have a responsibility to that going into the future? One of our colleagues had just done a health walk with some of the mothers, and how rewarding that was after the isolation was palpable.
Yeah. Great, great. Really good discussion. Janet, did you have anything to add?
No, well, there was a general feeling that they were quite broad. Whilst yes, it did state what we did, they were quite broad, and probably in the time that we had, people maybe didn't have enough time to properly read them or needed more reminding. Child development and childhood illness is something that hasn't really been mentioned, and it's something that students crave, especially if they're coming from an adult nursing background, and there doesn't seem to be much emphasis on that. But yes, generally they're very good. Generally they do state what we do, but you know, empowerment was another thing that was mentioned. I think perhaps there wasn't enough emphasis on empowerment of our clients as well.
Yeah, an interesting point. And of course, we've only sort of looked at 3 themes, trying to group things into 3 themes here. And if you look at the spheres and the field specific areas, you'll see child development is featured and illness as well. Yeah, it's difficult to cover it all, isn't it, in an hour, but all really interesting points. In my room, they were saying how it's great, you know, to see infant mental health included in there. It was felt that, you know, how important communication skills are and the complexity and the relationships and things like that we're working within, and that didn't seem to kind of come through within how we've identified relationships here from those field specific themes. So more on that was needed. Yeah, I think and yeah, the fact that it's great to see that that is more inclusive. So we're not just seeing words like we would have perhaps before, i.e. mother. You know, we're seeing parents, and it's looking more inclusive, and we need to be more inclusive within our roles as well. Okay, so you know, really interesting discussion. I'm going to share my screen again now, and just quickly bring up for you the last slides here. I'll just go through and the last slide just before we come to the polls is about responding to the consultation. So I know that these slides have gone out to you, so that's the link there in blue, so click on there. In my groups, members were saying that they're already engaged in the consultation. It doesn't take long at all, but if you want to really make a specific point, you have to strongly disagree with the comments. So strongly disagree, and then you can make your point and have your opinion, your view heard. So let's have a look. After the introduction, you were first asked about you, and then you go on to section B, where the questions about SCPHN standards for proficiency are more specific then. So just run through those questions, and you'll find that that's straightforward, really. So please click on that link, please engage. Can I ask Dave to please put the poll up just before we end? If you could please engage with the poll, I'd be really delighted. The first question, have the CPHVA webinars been beneficial in supporting you to consider and discuss what the draft standards mean to you and the future of SCPHN practice? Oh, fantastic. So I won't call those out because everyone seems to be okay with those. And 40% of you have already engaged in the consultation. 29% in the consultation, and 75% haven't. So please engage in that. This is your future, and don't miss your opportunity. We're going to think about whether we can put any more of these sessions on. But for now, I want to thank you for joining us. I'd like to thank Janet, Sue and Dave and all of you for helping us with this session today, and thank you for engaging so well and sharing your views and opinions, and please keep in touch, and we'll be in touch with you soon. I don't know if you want to add anything, Janet, at all as chair.
No, just I would reiterate everything you've said. I completely ask that you respond to this survey. This is your chance, this is your opportunity, and a tip is strongly disagree if you wish to put a point in. The survey is designed that if you don't strongly disagree, then you skip to the next question. You have no opportunity to put your point in. So not that we're suggesting you strongly disagree with everything, but where there are pertinent points, just remember that's how to go about it. But I couldn't ask you any more than to please respond. It is our future. Absolutely. And also maybe a quick mention of the CPHVA conference on the 9th of June. I'm sure you've all heard about that, but we're having a one-day conference via Zoom. So I would encourage you to have a look at that. We've got Suzanne Sadiq speaking in the afternoon and some other excellent speakers. So it's health and well-being, mental health and well-being throughout all ages, and particularly through COVID over the last year and a half. So really encourage you to join. Thank you.
Thank you, Janet, and thank you for engaging in the poll. And we're delighted to see that it's been helpful for you all. Okay, well, have a good evening, and thanks for joining, and we'll see you soon. Thanks, everyone.